wherever they end up. So for me, the structures should be rehabilitated, the equipment should be put there, the staffing, the remuneration, the payment, the salary of the health workers,
right, and
the drugs. This is a big question. The drugs is a big question. Some people say the drugs are not stolen, while others say the drugs are stolen. But maybe we need to know, how do we get adequate drugs to these health centers?
Yes.
Do we get adequate drugs? Because someone was telling me that even if they are stolen, theft is even in Europe. You have seen
4%.
You have seen in the.
So we should forgive them.
No. That's not what to say.
Yes.
But you've seen on TV in England when they were rioting.
Yes.
You've seen them stealing things from people.
So they say we should even.
So they also steal, but maybe they steal from too much. That even if they steal, it is still there. So what am I saying? That you can steal, you may steal, but if it is adequate, if it's a lot, you may fail to sell it anywhere, anyway.
Right.
Because if I steal drugs and I take them to the shop and nobody comes to buy them because there's plenty in the hospital,
there's no market,
then I will not steal. I will no longer steal. I will not steal because I will not have the market for the drugs.
Yes.
So for me, the issue of the supplies, the adequate or the inadequacy in the supplies could be one of the problems, that we don't have adequate drugs, or we don't send adequate drugs, and we don't send them on time. On my committee, as we were touring Kasese and I think Fort Portal hospitals and the HIV/AIDS committee in the last parliament, we found those places lacking nevirapine, and they had lacked nevirapine for almost 2 months.
Nevirapine is for
HIV drug.
Yeah, HIV. Yes, one of the drugs given. So, and ARVs were not there, and people were on ARVs and they had not taken their ARVs for about 2 weeks.
And you can't take only one drug.
And you can't take one, it's a combination, and you cannot. You should take it consistently.
You should not break.
You should not break. So, and when you ask, they say, we have not got the supplies. Did you give the order? When did you take your order? You know, and they were like, as if they took the order so late, or the person who was responsible was not in office. So all those inadequacies, all those problems should be sorted out.
All right. Dr. Bitekerezo, how about training and research?
Thank you so much. You know, before you go to training and research, you know, Honorable Najjemba is bringing some wonderful issues, and I'm very glad Honorable Najjemba is not a doctor, but she's sorting out things, and I'm very happy with you, by the Honorable. The problem we are having in this country is, if we have very many hospitals built, but without people to work in them, we are writing on water. And I want to be very crystal clear as far as this issue is concerned. I can tell you right now as we talk, I'm going to give a very wonderful example. Mubende Hospital, recently they posted 5 doctors to Mubende. I am reliably informed that nobody went to Mubende.
Where did they go?
Nobody knows where they are. They are just in Kampala here, my friend. They can't go there because Mubende, if you look at the house of a doctor, they can't post you there and you go there. Because the houses are not there.
Give them houses without carpet.
Yeah, but now let us go to some priorities. I can tell you, research is a very wonderful component in health, because you should know, we should be practicing what we call evidence-based medicine. But before we go to proper research in medical care, our problem right now in Uganda is not research. The problem is, how do I save a dying mother in the village when she is giving birth? Why should somebody die of a simple pneumonia? And why should somebody... Today I was very, very, very amused, and I could not believe it. People out there in the villages are giving everybody with a fever Coartem. That is the wastage of resources. One, Coartem is a drug we use for treatment of malaria.
Yes.
But not all fevers are caused by malaria.
Right.
We have malaria that is induced by simple viral infection, like even flu.
Yes.
I tell you, people with HIV, they get a variety of fever that are coming in, and the causes are enormous. There are very many. Even bacterial infections, they cause a fever. But can you imagine somebody has got a bacterial infection like a pneumonia, and you are giving somebody Coartem? We are saying, can we put a simple laboratory at this health center we have created, with a microscope, with some stains, with somebody who has done some laboratory science or training, and the doctor or a medical assistant at this health center, and with the drugs, so that people can get treatment that is appropriate in this country? That's what we are talking about. You know what I mean?
Yes.
But when Kwatem is pushed far deep in Nakapiripiriti, now everybody will know that the role from Minister from NMS came. They will all come and say, I have a fever, and because there's no technician. Everybody will be given Kwatem for even not malaria,
even when you have a flu,
and the drugs are going to get you within a second.
Actually, what happens in the health centers in the rural areas, when the drugs come, because they know the district vehicle has brought drugs,
yes,
they all line up, all of them, whether you are sick or not, they all come and take the drugs.
Maybe they want to stop.
Within 2 days, the drugs are over.
Do you see what's happening?
The uncertainty, because they're not sure.
So
that
basically,
if they fall sick, they will get the drugs. So they would rather have the drugs to themselves. In case they get sick, they just take the drugs.
Even when they are sick of something which is different from what they don't take the drugs.
They can treat flu with malaria drugs.
Yeah, man, taking flu with malaria drugs. You have an abscess somewhere, it gives you a fever, you take malaria drug. You have a pneumonia, you take malaria drug. You have, my goodness. By the way, do you know that even some cancers, they cause fevers?
So
you have got a cancer, instead
drug.
of just going to Mulago Cancer Institute, you just take malaria drugs.
So doctors are becoming like that woman in Masaka, Nanyonga, who used to give people soil.
I am telling you, when as a trained doctor,
there's one in Tanzania who is giving
Loliondo. So at the hospital become Loliondo one.
Oh my dear.
Drink this and then do regardless of your illness.
As now, Uganda has the doctors. Uganda has the midwives. Let us recruit them. Let us remunerate them. Let us house them. And let us respect them. So we can just look after them. You know, do you know somebody coming on this radio and he says, all nurses and all doctors still. By the way,
all nurses and all doctors
still drugs. Then I have worked. I have never stolen a Panadol. If anybody has ever seen me stealing Panadol, I am on radio. Let him ring me or let her ring me. I know some doctors in Mulago whom I respect. I can tell you, I know them. I cannot imagine. Let me just give a very simple example. I don't think that Professor Kanya in Mulago can steal anti-malarial drugs.
Myers Lukema was in jail after many years.
Man, I don't think that Professor Kanya can steal
heartbreaking thing, wasn't it?
I cannot imagine that Professor Harriet Mayanja of Mulago Hospital can steal.
Talk about the small health workers.
By the way, even in these
not professors,
I am coming to you.
Yes.
But people say that everybody in Mulago steals the drug. You know, it's a general comment by everybody. You know when they are talking. And I have said no. Let us say there are some people in Mulago with wild hearts who can take the drug. And I'm not going to say that in the midst of it, that everybody is very holy. Even in education, by the way, haven't you had some teachers raping children? You have heard these things have become. So, in other words,
but not all of them are the same.
But not all of the teachers are raping babies. So we don't want anybody to generalize that all health workers are stealing drugs. We are saying some are, and we don't condone stealing of drugs.
Yes,
it's very dangerous and unethical.
Right.
But what we want is some protection for health workers who are still having the heart to work here. You know, there are some doctors who have run out of this country. You have been trained by Ugandan money. You are even given money to go outside to study. You don't even come back. Are you not a criminal? You are living here today.
This is Spectrum on Radio 1. You can call in our numbers 0414-348-111, 0312-260-390, 0312-261-390. When you call in, please tell us your name and where you're calling from. Spectrum, hello?
Yes, Edmond. Good evening.
Good evening, your name?
Thank you for hosting the guest. I'm called AM.
Yeah.
Yes, I'm calling from King Fahd here, but I was really perturbed when Honorable Najjemba said that he was referring our situation to the one of what happened, the nightmare which happened in London, that even in London they steal. I think they don't steal drugs. That was looting. And the problem is just the morals of our doctors and medics. They are the one who don't, in fact, they are the one who are bringing this country down, because when you are trained, you have to save the people's lives. Then you connive with the traders and you sell up the medicine. I think we should condemn it. Thank you.
Spectrum, hello? Okay. Dr. Bitekerezo.
Yes.
Talk to us about it.
There's I came from King Fahd. I think he has got a point.
Okay, we have another call. Let's take them. Spectrum, hello? Hello? Okay, hello?
Yes, hello?
Your name, sir? You're live on Spectrum. Your name?
Hello? Yeah, this is saying now. I think those two gentlemen don't feel supporting the wrong government, because even in the environment things were not well. Even in the medical sector, everything is not doing well. Even in infrastructure, everything is not doing well. So I think they are supporting. Government, they should be the ones in leadership, and they should kick out the old people who are there because they are not seeing what should be done. They are the young people, they are the ones who are seeing that what should be done. The old people are out, and they should not support those old people. They should support themselves to take leadership of this country. Thank you.
Spectrum, hello.
Hello, Edmund, how are you?
Very well, thanks. Your name?
Hello?
Your name, sir? You're live on air. Can you tell us your name?
Yes, Edmund. Thank you very much for bringing the guest into the studio.
Your name?
Yeah, I especially want to thank the doctor who has represented there.
Can you tell us your name, sir?
I'm a regular contributor in Spectrum.
Your name?
Yeah, so I would like to point out one thing about the medical fraternity in this country.
Yes.
As the doctor pointed out, that the plight of doctors in this country is suffering, and it's beyond really. We can't put up with it anymore. So, whereas we have the brain drain going on, we don't have only the external brain drain like the doctor has pointed out, where people leave the country for greener pastures. We have lots of internal brain drain, where you have a job is advertised in Kampala, someone in Masaka comes and occupies it, then Masaka is vacant. Then someone in, let's say, Masindi comes to occupy Masaka. Then now when Ajumani when Masindi advertises, someone from Ajumani comes to fill up Masindi. So everyone is trying to come towards the center, and that leaves everyone running to the center, where we have nearly 90% of the 2,700 doctors practicing in Uganda are within Kampala, yet more than 90% of the population lives elsewhere. So that's one of the biggest factors of the brain drain. But that also, it's because government has not done much to contribute to the pull factors for doctors to stay around. In fact, they're just being part of the push factors, where now they're actually trying to force people into practice.
All right. Okay, thank you. Spectrum, hello.
Hello?
Please switch off your radio. Your name?
Thanks. My name is Andrew from Kampala. I want to thank the guests you have in the studio. I just want to re-emphasize the late point that, the priorities that we need today really should be directed to rehabilitating the existing health centers. Now, for the Honorable in Parliament, really, I think any proposals that should come from you should be thrown out unless they are aimed at developing and re-equipping these health centers. I think you're doing a good job by, throwing out these luxurious claims and things like that. So I thank you very much for that.
All right, Andrew. Spectrum, hello. Hello. Your name? Okay, let's get back to
explain a little on.
Okay, Honorable.
Let me help you.
Okay.
Thank you so much. Thank you so much, our dear listeners. I want to respond to some of these things, Mr. Edmund, and mostly I want to go to the person from King Fahad, who was talking about Honorable Najjemba's comment. Let me tell you something. In the normal supply of drugs in the world, 4% of the drugs supplied can end up going into waste. Expiries. You can talk about some damages actually within transportation and even some of those things happen. But at least 96% of the drugs that are supplied, that is, we are talking about a standard supply
globally.
In a global scenario.
What's the situation?
It goes to the
waste. How about Uganda?
To the health consumer, to the service consumer.
How about our situation?
Now in Uganda, what's happening right now? We have got some very interesting things. Number one, the drugs that first of all, the budget is not enough. In other words, health has not been given a very wonderful priority as far as I'm concerned, and I'm talking as a doctor this time now, not as a politician.
But even NRM should be supporting.
Of course,
with one hand.
We are NRM, but remember that when in NRM, our work is very simple. We, as members of Parliament, we must do what we call a proper oversight role, and we do not want to lead by pretense. Let us be honest with ourselves, because I can't say that my government has done nothing completely, but if it has not performed, if it has got 100%, I have got the right as a Ugandan to say here, we are not okay. That's what me and Najjemba we are doing here.
Yes.
But we are saying doctors in government hospitals right now as we talk. By the way, today I was talking in the social service committee. There is a university that is training doctors. The doctors that are training these young doctors have refused to offer service delivery to the patients in the hospital. I was wondering, I said, look.
What do you mean by that?
You know, they have jammed to touch patients in the hospital. That for them, they are employed by the university. And I gave an example. I said, I am here. I have been a lecturer in the Department of Internal Medicine in Mbarara University of Science and Technology for 10 years. But I can tell you, I am the one who began the diabetes clinic in Mbarara Referral Hospital. I was not earning even a single drop of coin from the Ministry of Health. I was not on their payroll. But I did it as a service to the people on whose money I went to university, because I've never paid any money at university. I went for government sponsorship. So I was grateful to my government for having given me some what. And the money which I used when I was Najjemba and Mr. Edmond, it came from the Uganda taxpayers' money. So I gave a service. So I was telling them, I said, please, I know the money is a bit small, but give a service to these patients who you have used as teaching materials.
Right.
You have found him with a pneumonia.
Yes.
Give him an antibiotic, plus an analgesic or an antibiotic, and give him some water so the person doesn't become terribly dehydrated. And then God will reward you as we push government to increase salaries for this what? For these nurses and doctors. But they shouldn't abandon, because it's very unethical. Point number 2. Somebody was talking about the young people taking it. I think we have, by the way, right now, why this parliament possibly is becoming the way it is becoming. I don't know whether you're aware that the average age of the parliamentarians we have in the 9th parliament is 40 years of age. What do you expect? And you know, there's a saying that a fool at 40 is a fool forever. Which means right now, as we talk, we want people to appreciate that we are younger.
Right.
And we know that if we don't die in car accidents or somebody doesn't kill us, we may go as far as at least 80 years of age or 70. For that matter, we must make sure that we prepare a very good ground for our children behind,
Right.
who are coming in, those ones who are not yet born, and those ones in front, even these ones who are very old. We want people to die in dignity, but we want hospitals to function. But all in all, we must see how we can create because this is now competition. You sack a doctor from Uganda today, tomorrow he's at Bunagana now, going to Chigali. Can you imagine? You know, I am one again of those doctors. I went to Swaziland with my own wife, who is a doctor like me. I was given a job almost, actually in Manzini, that is the trading city of Swaziland. And I was put to work in the TB ward.
Yes.
And I was going to work in patients with TB which does not respond to TB drugs that we have common there. And these were minors from South Africa. Now my conscience told me that, look, you started on Ugandans' money. Now you're going to be here at some point in time. You may end up getting MDR TB from Swaziland here. Then you die from there. Then they fly me from Manzini to Johannesburg, from Johannesburg to Nairobi, then from Nairobi to Kampala, then from Kampala to Mbarara. I said, oh my goodness. Do you know what we did? Me and my wife, we just got back on the plane, and we are here. We have been working in our own country. We are saying we must sacrifice for our country, but we want again our government to recognize that there are some doctors who have actually sacrificed to remain around. We must handle them very carefully, and we must tell these young ones who are coming up that this is not the end of the world. The parliament, I can tell you, this parliament of ours, I tell you, I am too glad I am in this 9th parliament. If I never came, I don't know where I would be. These people we are from different parties.
Right, okay.
But when it comes to social services, my friend,
You seem to agree.
we seem to agree. You have seen what, this is a proper movement. I can tell you, I'm a movementist. But we are saying what kills an FDC is what kills the movementist. It is what kills the UPC guy. We must survive, I'm telling you.
Honorable Najjemba, as you respond, you can talk to us about health financing systems as well.
Okay, I also wanted to make a comment which Dr. Bitekerezo made clear, but since it was addressed to me, I think I should make myself clear. I talked about theft of drugs because it has been talked about a lot in Uganda, that drugs are being stolen, and I said if the drugs were adequate enough, I think even the stealing would cease, because if you have nowhere to sell them, then you will not steal, because if you sell them in the shops and people don't buy them because they are free drugs in the health centers, then you will cease, you will not steal them again. So I want to make myself clear on that, that maybe it's not that the drugs are stolen per se, but maybe they are not adequate. They are not enough.
We don't have enough drugs.
We don't have enough drugs, and so we need to look into possibilities of having enough drugs in our centers, and also timely drugs. Deliveries of drugs.
Right.
One person talked about everything not doing well. I don't want to say that everything is not doing well, but we are doing something, but we need to do much more than we are doing.
Right.
There's something. When this government came to power, we were not balancing our budget. I think we are around maybe below 50%. Yes, we don't balance it, but we are at a certain level. At least we are now about 70%. We can balance our budget by about 70%.
Yes.
If there was no waste, if there was no corruption,
right,
I'm sure I would be able to be a little bit further than we are. But now what we need to do as members of parliament and as all other stakeholders, including the media, is to try and expose the people that are letting us down. Yes. And those are the corrupt people.
Right.
Try and expose them all over, so that wherever they go, they are not welcome. But you know what happens when somebody gets a job and within 1 year that person buys a BMW or a very nice car and builds a very good house, then people start praising him. Oh, so and so's son is doing well, he's hardworking, he has done ABCD. You see, they start even comparing. And
that is only a hardworking thief.
And yet, you know, when you look into where he gets his money, is actually in Jaulo, as they call it. That's why I'm going back to the seminars and workshops. To have a project and you don't have seminars and workshops and meetings, then you will not get anything out of it.
Right.
For example, if you are given a project to equip health centers with delivery beds in the whole country, and you are going to buy delivery beds and all those things, you may not get a lot of money out of it.
Yes.
But if you have a seminar, you can know how to manage it.
Talk to the hotel manager.
It's easy to talk to the hotel manager.
Reduce the number of samosas.
Reduce the number of participants, include the few, sign for a few others. That's where they make their money from.
So for me, hotel room rates.
And overcharging. So for me, I think we need to set our priorities right. Uganda has some resources. I don't want to say enough resources.
Right.
We have some resources that, if we can utilize them well, we can be somewhere. But because a lot of resources are going into waste, a lot of money is going into people's pockets, a few people are getting a lot of money at the expense of the majority, that's where the problem is. And as members of parliament, it is our role to point out these issues, because whereas we are NRM, we are not the executive.
Right.
We are supposed to check on the executive, and we are supposed to point out these issues so that our government can continue. We want this government to continue even for the next 50 years.
Yes.
But there's no way we can have it continue unless we expose the thieves within the government and all these inadequacies that we are finding in our departments.
Well, even
that's how we can continue. And I know the president will be happy.
Has spoken about those thieves.
Yes.
He went to Rwanda and said something about many thieves in Uganda. But we have to end here. Thank you very much, guest.
I have a comment.
We have to, maybe next time. Dr. Medard Bitekerezo, Mbarara Municipality Mp, member of the Social Services Committee. Thank you for coming to Spectrum, sir.
Thank you so much, my brother.
Honorable Rosemary Najjemba Muyinda, Chairperson of the HIV and AIDS Committee of Parliament, also member of Parliament for Gomba constituency. It used to be called Mpiji, now it's Gomba
district. Gomba constituency, Gomba district. But next time you invite us, I would like to talk about, we didn't have enough time, health financing systems in this country.
Right.
Yeah.
Maybe we'll talk about that.
The health insurance and all that.
Exactly. In Rwanda, they have health insurance for everyone. Thank you for tuning in. I've been your host, Edmond Tizisto. Stay tuned for the news in English, read by Najjemba.
Let's talk about the home of your dreams and how you plan to finance it. Let's discuss money, location, and time frame.